My name is Laurie, and I'm a pelvic floor physiotherapist, and I wanted to talk about urge. Urge, particularly in the bladder. We've all felt it when we've had a really full bladder and needed to go badly. But you can also feel it with a bladder infection, and often when you empty your bladder, there's really quite a strong burning sensation. One of the other times that you can feel urge that feels like it's coming from the bladder is actually coming from some of the muscles deep inside the pelvis, and you can reach these. They attach onto the front of the bone, and a pelvic floor physiotherapist can reach them internally, either through the vagina or through the rectum. A lot of patients get some really good relief when that's the problem and the reason for their urgency. It can happen after surgery. Sometimes it happens after the bladder has been irritated for some other reason. Sometimes we don't know where it comes from. Urgency can also come from things that you're consuming in food and beverages. One of the most common is caffeine, so I tell a lot of people that maybe we need to cut back on coffee. Not always an easy message, but we use a bladder diary as well. So many people will go home with a bladder diary just to keep track of what you're taking in a day and roughly how much you're emptying your bladder. Caffeine is one of them, but food additives, medications can be part of it too. If you empty your bladder and know that that's quite a dark, strong yellow color, that's usually a sign that you're kind of dehydrated. So one of the things we measure with a bladder diary is the water intake. If it's really strong in color and quite concentrated, it can be an irritant to the lining of the bladder, and that usually makes the urge worse. So things to think about with urge.